Hello, and welcome to this episode of Capital City News. As you can tell, the world is operating a little differently this week and might for the foreseeable future because of the continually evolving COVID-19 pandemic and last week's earthquake. Please note that we here at Capital City News are still dedicated to bringing you the latest news and updates as it relates to Salt Lake City and our government. This week, we'll give you all the resources you need to get information as you navigate the current landscape of the city and try to get used to self-isolation. Let's start with our legislative update from the City Council's first telemeeting last week.
At its March 17th meeting, which was their first virtual meeting ever, the City Council discussed a proposal to expedite $1 million to help local businesses affected by the COVID-19 pandemic, received a briefing from the city attorney about the separation of powers between mayor and council and how that changes during emergency declarations, and they rescheduled several agenda items to accommodate budget and emergency funding discussions. To learn more, visit slc.gov/council.
As many of you know, there's a lot of information circulating out there about coronavirus, and a lot of misinformation as well. We want to make sure that you have access to the most up-to-date and accurate information as possible so you can keep your family, your friends, and fellow Salt Lakers safe during this challenging time. To help you, Salt Lake City has established a COVID-19 website with answers to your frequently asked questions. It will let you know what to do if you feel sick, how to prepare for self-isolation, and what city services are still functioning. It also links to resources for business, neighbors looking to help other neighbors, and more. The Salt Lake County Health Department is also a site you should check for news about COVID-19 issues in the Valley. They'll have the latest on which county service providers are open during this time, along with status information on the opening or closure of restaurants and other venues in the Valley. The Utah Department of Health also has a website that has the latest information about statewide health alerts and executive orders regarding coronavirus from Governor Herbert. They're also a portal to official updates from the Centers for Disease Control, which is the national response team and will disseminate information to Americans across the country. For more information about the global perspective to the pandemic, the World Health Organization has all the latest stats and recommendations from around the world. As for the earthquake, things are getting back to normal, but it's important to remember that aftershocks can be a common occurrence a week or more after the initial quake. In the event of a major aftershock, here are some things to remember. Take cover under a desk or a table if possible. Once it's safe to do so, and there are no obvious damages, inspect your home to make sure there are no structural issues, gas leaks, or any electrical problems. If you have to call 911 emergency for help, please be sure to let dispatchers know if you're experiencing any symptoms of COVID-19. Most importantly, stay safe, and if you have to leave your house because of an aftershock, maintain social distancing. And now it's time for a History Minute. This month is Women's History Month, and in addition to that, we wanted to honor the history of first responders and medical professionals who are on the front line addressing this pandemic. Our History Minute is about the women of Salt Lake City who answered the call during World War I.
At the outset of World War I, it was apparent that everyone in the United States would be needed to take part in the war effort both directly and indirectly. The U.S. worked diligently to recruit more than 25,000 nurses to work in the war hospitals both at home and abroad by the end of 1917. At the beginning of the war, Utah had only 450 trained nurses in the entire state, but that didn't stop those women from enlisting to help. 80 registered female nurses from Utah served in the war, whether that was in trauma hospitals, at the front, or elsewhere. One of the most prominent World War I nurses was Anna Rosenkind. She served in France with the Army Nurse Corps and in 1922 became the first nurse hired by the new primary children's hospital. She stayed and became the superintendent there until her retirement in the 1940s. She was so beloved there as a caregiver, the patients of the hospital called her Mama Rose. Women with some medical training or other specialties managed to serve in the war in other ways. Some even drove ambulances. One of the most infamous female ambulance drivers from Salt Lake City was Betty McCune. She was the daughter of one of Utah's first millionaires, Alfred McCune, and she learned how to be an auto mechanic at a shop at Exchange Place. Since most ambulance drivers during the war were private affairs run by charities or other nonprofits, McCune sailed herself and her ambulance to the front on her own dime and continued to support herself while she transported wounded soldiers from the front to hospitals. With the signing of the armistice that ended the war in 1918, this chapter of history closed for the women serving as nurses. Almost 300 nurses lost their lives during the conflict, but none of those were from Utah.
That's it for Capital City News this week. Stay connected on the latest updates and resources on our Salt Lake City Gov Facebook, Twitter, Instagram, and Nextdoor accounts. Thanks for watching. Take care, be safe, and stay well. For SLC TV, I'm Poonam Kumar.